Hello friends, welcome back to the channel. Today we are discussing about adverse drug reaction ADR. So what is ADR or adverse drug reaction? WHO World Health Organization defines ADR as a response to a drug which is noxious and unintended and which occurs at doses normally used in men for prophylaxis, diagnosis or therapy of disease or for the modification of physiologic function. For the definition of ADR, these terms are very important. One is noxious and unintended, and other is for prophylaxis, diagnosis, or therapy. This is all about the definition of adverse drug reaction. It's shortly called as ADR. So, what are the causes and what are the factors affecting adverse drug reaction? So, what are the causes? The main causes was fail to take at correct times. Now, some people, what they will do, they do not take the dose in the correct time. The correct time is also one of the cause of the ADR. And if the particular person have taken the overdose, the dose can causes the ADR. So, if you are taking the prescription of some other person, it can also causes the ADR, means taking other drugs or preparation that interact with the medicine and taking a medicine that was prescribed for someone else. If you are taking the other drugs and preparation which interacts with the medicine, it will causes the ADR. Another important cause of adverse drug reaction was it will combining the medicine with the alcohol. If you are combining the drugs with alcohol, definitely it is going to causes the adverse drug reaction. And what are the factors that affecting the ADR? First is sex, age, diet, smoking, genetic influences, previous adverse drug reaction, total number of medication, and concurrent disease. What are the concurrent disease? Renal disease, liver disease, and cardiac disease. These all are the factors affecting adverse drug reaction. So here when you had administered the drug, definitely the drug will bind to its receptor and it will shows the pharmacological action. So when the drug bind to the receptor, it will shows the pharmacological action and at the same time it can shows the undesirable effect also. It is the form of the pharmacodynamic effect. So what is pharmacodynamic effect? The pharmacodynamic means what the drug is going to bring the changes inside the body. What are the effect? It may be desirable or it may be undesirable. So if it is a desirable effect, nothing to worry, and if it is undesirable effect, which you can call as an adverse drug reaction, shortly called as ADR. So if you had taken any drug which causes the undesirable effect, so what is going to happen? We will discuss one by one here. Pharmacodynamic effect has been classified into two types. One is the desirable effect, another one is the undesirable effect. Undesirable effect is further classified into three types. Expected undesirable effects means type A, unexpected undesirable effect means type B, and others means type C, D, E, F. Expected undesirable effects also called as side effects, secondary effects, toxicity. In unexpected undesirable effect, you can see hypersensitivity, genetically determined adverse effect, and also idiosyncrasy. How many types the adverse drug reactions has been classified? Depending upon the type of reactions. Second, on the basis of severity. And last is the one of basis of onset, means onset of action. The type of reactions, what are the type? Type A, B, C, D, E, F. On the basis of severity, what are the types? Mild ADR, moderate ADR, severe, and lethal. And the onset of action, acute, subacute, and latent. First is type A reaction, which you can call as an augmented reaction. A means augmented. These are the extension effects. It's a predictable. What are the dose related responses? And prevention prevented by adjustment of doses regimen. What are the examples? Benzodiazepines called sedation. Furosemide causes water and electrolyte imbalance. Warfarin causes spontaneous bleeding. Insulin causes hypoglycemia. Second is the type B reactions, also called as Bijari reaction. It is abnormal effects, high mortality, unrelated from the drugs, unknown pharmacological action. So, high mortality rates are seen. This is uncommon and also unpredictable, not related to the pharmacological action of the drug. Example, immunologic reactions, anaphylaxis to penicillin. Idiosyncratic reactions, example, malignant hyperthermia with general anesthetics. What is the management? We told and avoid in future. Type C reactions or continuous or chronic. Long-term effects are usually related to the dose and duration of treatment. Long-term effects when seen when the dose and duration of treatment is reversible with the long-term effect. It's also uncommon and relative to the cumulative dose. Examples, ethambutol causes retinopathy. NSAIDs, non-steroidal anti-inflammatory drugs, causes nephrotoxicity and colonic dysfunction due to laxatives. What are the managements? Reduce dose or use an alternate day therapy. Also, withdrawal may be have to be prolonged. Type D reactions. D means delayed. It's also called uncommon, usually dose related, occurs or becomes apparent sometime after use of the drug. What are the example? Carcinogenesis, teratogenesis, and thalidomide. What is the management? Often intractable. Reactions or ending of use. What are the features? Uncommon, occur soon after withdrawal of the drug. What are the example? Benzodiazepines causes rebound insomnia, agitation, and anxiety. Beta blockers, what causes rebound hypertension. Corticosteroids, acute adrenal insufficiency. How this is managed? Reintroduce drug and withdraw slowly. First is reintroduce drug and second is the withdraw slowly. Type F reactions or failure of efficacy. What are the features? Common, dose related, underdosing of medication and often caused by drug interaction. What are the example? Oral contraceptive when used with an enzyme inducer and resistance to antimicrobial agents. What is the management's increased doses?